It seems like healthcare tech is changing so fast these days.
I know, right.
Like, was it really that long ago that telemedicine was the next big thing?
Yeah.
But now we're talking about AI doctors and robots doing surgery.
Yeah, it's incredible.
So for this deep dive, we're focusing in on something that's been, like, exploding in popularity. E-health apps.
Okay.
And we've actually got a really cool research project to dig into.
Okay.
They looked at 5 specific apps, but we're also going to zoom out and look at the whole e-health scene, both the good and the bad.
Sounds good.
So for everyone listening, think of this deep dive as your guide to really understanding these apps.
Yeah.
Like, what do they actually do? How do they affect patients? What about the healthcare system as a whole?
All good questions.
And a big one for me, how do we make sure we're using all this tech responsibly?
Right. Ethically.
Exactly.
Well, let's define things first.
Okay.
E-health basically means using any kind of tech to deliver healthcare better,
Okay.
to do research better, education better, you name it.
So it's a broad term. Got it.
And e-health apps are tools within that,
Uh-huh.
and they're designed to give patients more control over their own health.
Okay, so like, if I'm using an app to track my symptoms,
Yes.
or to like remind me to take my meds,
Yep.
or even to get advice from a doctor, but like remotely,
Exactly.
that's all e-health.
Those are all great examples of e-health apps.
Okay, cool.
And the research project we're looking at is a really good place to start
Oh.
because it's international.
Oh, wow.
Researchers from 6 different countries were involved.
Wow. Okay, so
Netherlands, Denmark, Norway, Australia, the US, and the UK.
they're really taking this seriously.
Oh, absolutely.
Global effort.
Yeah, definitely.
Okay, so which apps did they look at?
They studied 5 different apps: Thisarts.nl,
Okay.
Liva Healthcare, Shati, Babylon, and Skin Vision.
Okay, and were they trying to figure out like which app is the best?
It was actually broader than that. They had 2 main goals.
Okay.
The first was to figure out best practices for developing and using these apps.
So like, what makes a good e-health app?
Exactly.
What should developers keep in mind?
Yeah.
What about
yeah.
the ethical side of things?
Huge, yeah.
Oh, that.
Huge part of it, yeah.
Okay, makes sense.
Their second goal was to help general practitioners.
Okay, GPs.
Yes, GPs, exactly, to understand how these apps could fit into what they already do.
Well, yeah, because if doctors aren't on board,
Right.
it doesn't matter how good the app is.
Exactly. It's about collaboration.
It's got to work for both sides.
Yeah. Integration between the tech and the, traditional healthcare system.
Totally.
Yeah.
Okay, so let's get into it.
Okay.
What are the big pluses of these e-health apps?
Well, one of the biggest things that came out of this research,
Okay.
and something I think everyone listening can relate to,
Yeah.
is ease of use.
Makes sense.
They're designed to be simple, intuitive.
Yeah, because I've downloaded some health apps that are like so complicated.
Right.
I'd give up after 5 minutes.
Yeah, and then what's the point?
Exactly.
Okay.
It defeats the purpose.
It does.
Okay,
So-
so easy to use.
Easy to use. That's number one.
What else?
Another big advantage is that they're available 24/7.
Oh, yes. That's a big one.
Unlike your doctor's office.
Yeah, seriously.
Yeah.
We've all been there, like it's 9 p.m., you're worried about something,
Exactly.
but it's not an emergency, you know?
Right.
So do you go to the ER?
Yeah, do you wait?
It's a tough call.
It is, yeah.
But with an app, you could maybe get some reassurance right away.
Exactly. You've got that support when you need it most.
That peace of mind.
Yes, exactly.
Okay, so ease of use, 247 access,
Yeah.
and I'm going to guess cutting down on waiting time
Oh, absolutely.
because nobody likes sitting in a doctor's waiting room.
Nobody. Yeah.
So these apps offer a speed and a convenience that you just don't get with, like, scheduling an appointment.
Right. Like you need a quick answer to a simple question.
Yeah.
An app could give you that in seconds.
And, okay, thinking about it from the healthcare system's point of view, that could be huge.
Huge.
Less demand for actual office visits.
Saves everyone time and money, potentially.
Okay, so what else is on the list of e-health app advantages?
This one might surprise you.
Oh,
The research actually found that in many cases, these apps led to better outcomes for patients.
wow, really?
Yeah, so it's not just about convenience.
Right, it's actually improving people's health.
That's what the data suggests, yeah.
But, I mean, we need more research, right,
Of course, long-term studies are essential.
to really know for sure.
Yeah,
But still, that's promising.
very promising.
Okay, so what kind of outcomes are we talking about here?
Well, it's probably a few things combined.
Okay.
Some apps give you personalized advice that helps you make healthier choices.
Uh-huh.
Others might actually improve communication between patients and their doctors.
So better management of, like, chronic conditions.
Exactly.
Fascinating.
Yeah, so the potential is definitely there.
To not just make things easier, but to really make a difference in people's lives.
Exactly.
Okay, but what about the elephant in the room?
What's that?
Data privacy.
Ah, yes.
It seems like every other week there's a news story about some data breach or some app selling our info.
It's a valid concern.
Yeah, especially with something as sensitive as health information.
Absolutely.
So how do e-health apps handle that?
The good news is a lot of them are designed with data privacy in mind from the get-go.
Okay, good.
Like, they minimize what they collect in the first place.
Okay.
And a lot of them don't have any impact on treatment decisions.
What do you mean?
I mean, they're meant to supplement, not replace, a doctor's judgment.
Okay, so it's more about information and support, not about, like, self-diagnosing.
Right, exactly.
Got it.
So when you're choosing an app, look for one with a really clear privacy policy.
One that I could actually understand.
Yes, exactly.
Not just a bunch of legal jargon.
Right. It should tell you exactly what data they're collecting,
Okay.
how they're using it, if they share it with anyone.
And if an app is being cagey about all that,
Yeah.
red flag?
Yeah. Move on.
There are other options out there.
Plenty.
Okay, so data privacy, that's one potential downside.
Yeah.
Anything else we should be aware of?
Well, some doctors are concerned about these apps.
Oh, interesting. Why?
Some feel like they're losing control.
Like, patients are coming in with all this info from their app,
Right.
and it's changing the whole doctor-patient dynamic.
Exactly.
I could see that.
And there's the financial side of things, too.
Ah, right.
If people need fewer in-person visits because of apps,
Yeah.
doctors could lose revenue.
Right. It's disrupting the whole system.
It is, yeah.
Okay, so it's more complicated than it seems at first glance.
Oh, for sure.
And then there's the research, or lack thereof.
Right.
We need more long-term studies
We do.
to know for sure what the impact of these apps really is.
Yeah, to see those unintended consequences.
And how to integrate them into the system in a way that actually benefits everyone.
Exactly, yeah.
Okay, so e-health apps, that's just one piece of the puzzle.
Yeah.
What about mobile healthcare more broadly?
Oh, great question.
What does that look like?
So mobile healthcare is basically about bringing healthcare to the people
Okay,
wherever they are.
and that means more than just apps, right?
It does,
So
yeah.
like mobile clinics,
Yes.
telemedicine, stuff like that.
Yes, all about breaking down those barriers.
I'm picturing a van like rolling into a village,
Yeah.
bringing doctors and medicine to people who might not have access otherwise.
Exactly. And there are some amazing examples of this happening all over the world.
Really?
Yeah, like in rural Tanzania, they've been using mobile clinics to lower maternal mortality rates.
Wow, that's amazing.
Yeah, they bring prenatal care to women who would never get it otherwise.
That's life-saving stuff.
It is.
Okay, but I imagine there are challenges too, right?
Oh, absolutely.
Like logistically, how do you keep those mobile operations running smoothly?
Yeah, the logistics can be tricky. Yeah, keeping those mobile operations running, it's not always easy.
What are some of the biggest hurdles?
Well, one of the toughest parts, surprisingly, isn't the medical stuff.
Oh, right.
It's the logistics.
Uh,
Think about it. You've got vehicles to maintain,
Yeah.
medical equipment, making sure you have a reliable supply chain.
it's a lot to juggle.
It is, especially in areas with, limited infrastructure.
Yeah, if your mobile clinic breaks down in the middle of nowhere,
Right, exactly.
that's a problem.
It is.
And what about the people?
Staff.
Finding qualified people to work in these often pretty remote areas.
Yeah, that can be a real challenge.
And then keeping them.
Retention is huge.
I mean, these healthcare workers are going above and beyond,
They are.
often working in really tough conditions.
Absolutely.
It's got to be demanding.
It is, yeah.
And we have to be realistic about the limitations of this kind of care.
Right.
As amazing as mobile clinics are,
Yeah.
they can't do everything.
They can't, no, they're not a replacement for a fully equipped hospital.
So if someone needs like complex surgery or a very specialized kind of treatment,
Yeah.
a mobile clinic isn't enough.
No, not at all.
And there's another potential risk.
Oh, yeah. A big one, actually.
What's that?
We have to be very careful not to create a dependency.
Oh, interesting. What do you mean?
Well, the goal is to empower these communities.
Right. To help them be self-sufficient.
Exactly, when it comes to healthcare.
But if mobile clinics are the only source of care,
Right.
it could actually hinder progress.
It could. Yeah.
Because there's no incentive to build up their own local healthcare facilities.
Exactly.
Okay, yeah, I see what you mean.
It's like that saying, give a man a fish.
Yeah. You feed him for a day,
Teach a man to fish.
you feed him for a lifetime.
Exactly.
We need to make sure mobile healthcare is part of a larger strategy,
Yes, a bridge.
not a final destination.
Right.
There was that project in Ghana, right?
Oh, yeah, the one with the mobile clinics.
They were doing great work.
Amazing work, reaching all these communities.
But then the funding got cut.
And those communities were left with nothing.
Because they hadn't developed their own healthcare infrastructure.
Exactly.
It's a cautionary tale.
It is.
Highlights the need for, like, sustainable funding models.
Yeah, and a long-term vision.
That goes beyond just providing immediate care.
Absolutely.
Okay, so we've explored mobile healthcare in general.
We have.
Now let's bring it back to the e-health apps.
Okay.
We talked about some pros and cons.
Yeah.
But what separates a good e-health app from a bad one?
That's a great question.
What should we be looking for?
Well, this goes back to that research project.
Okay.
One of their goals was to define best practices.
Right.
And based on what they found, along with some insights from other experts like Dr. Esther Telboom-Camp at Unilabs,
Great.
there are 5 key criteria that stand out.
Okay, let's hear 'em.
All right, number 1, global reach.
Makes sense. Health is a global issue.
It is. These apps should be accessible to everyone.
No matter where they live
Exactly.
or what language they speak.
Yeah. Right, and it's not just about translating the app.
Wow, okay.
It's about being culturally sensitive.
So, taking into account different healthcare beliefs and practices, it's got to be designed for a global audience.
Yes, a truly global audience.
Not just like a Western perspective.
Right, exactly.
Okay, so global reach, that's number 1.
Number 1.
What's number 2?
Number 2 is customized advice.
So, not just generic tips
No, the app should tailor its recommendations.
to each individual user.
Exactly, based on their needs.
Your health information.
Yeah, their goals, maybe even their personality.
Wow, so it's like having a personalized health coach in your pocket?
It's getting close to that, yeah.
Okay, that's number 2.
Number 2.
What's next?
Number 3 is something we talked about earlier.
Okay.
Solid science.
Yeah, the info in the app has to be accurate.
It does. It has to be reliable, evidence-based.
No misinformation.
No, absolutely not.
We need to be able to trust these apps.
We do, and that trust comes from transparency.
So the app should be upfront about where its info comes from.
Yes, and its methodology.
And if there are any limitations.
Right, exactly.
Okay, so we've got global reach, customized advice, solid science.
Mm-hmm.
What are the last 2?
Number 4 is advanced functionality.
Okay, so what does that mean?
Basically, it's about what the app can do.
Okay.
Does it track your symptoms?
Okay.
Remind you to take your meds?
Yeah.
Does it let you message your doctor securely?
Ah, interesting.
Can it connect with other health devices you might be using?
So the more features, the better.
Well, not necessarily.
Sure.
It's about the quality of those features.
They got to be well designed.
Yes, easy to use and actually useful.
So it's not just about having a long list of features.
Right, it's about how those features work together.
To create a positive experience for the user.
Exactly.
All right, and the 5th and final criterion.
Ethical standards.
Ah, yes, we talked about this a bit.
We did.
But it's worth emphasizing.
It is. It's crucial.
So it's about data privacy, but it's also broader than that, right?
Yes. It's about the whole development process.
Okay.
How the app is used, making sure it's all responsible.
So, like, what are some concrete examples?
Well, being transparent about how user data is collected
Okay.
and used, making sure the algorithms are fair, no bias,
Oh, yeah, that's important.
and being honest about the limitations of the technology.
Right, not overselling it.
Exactly.
It's about putting the user first.
Always.
Okay, so these 5 criteria.
Yeah.
Global reach, customized advice, solid science, advanced functionality, ethical standards.
Those are the pillars of a successful e-health app.
But those are just the app itself.
Right.
What about the human factor?
You're talking about doctors.
Yeah, do they need to be on board for these apps to really work?
Absolutely.
If doctors aren't willing to integrate them into their practice,
It's not going to work.
it's all about that collaboration.
It is, yeah.
Okay, so it's not just about the tech.
No.
It's about how it fits into the whole healthcare ecosystem.
Exactly. Technology can be a powerful tool,
It can.
but it has to be used thoughtfully
Responsible.
and collaboratively.
Yeah, I think that's a good takeaway.
I think so, too.
It really feels like we're at this, like, crossroads in healthcare.
Yeah, it's true.
We've got all this incredible tech,
Mm-hmm.
all these possibilities,
Yeah,
but we're still trying to figure out
yeah.
how to use it all responsibly,
Responsibly, ethically.
right, and effectively.
It's like we're exploring this whole new territory.
A new frontier.
Yeah, exactly.
And I think patients are feeling that too.
The uncertainty,
Yeah, like they're more involved in their own healthcare now.
which is great.
It is, but it also comes with challenges.
Definitely.
So traditionally, patients have been kind of passive.
Mm-hmm.
They just do what the doctor says.
Right.
But e-health is changing that.
It is, yeah.
It's
Yeah.
giving them a more active role.
More control.
So now they're doing their own research online.
Hmm.
They're tracking their symptoms on apps.
Yeah.
And they're coming to appointments with a whole list of questions.
It's a whole new dynamic.
It is.
And it can be really empowering for patients.
It can.
But it also means they need to be more careful.
Because, let's be honest, not everything you read online is true.
Oh, absolutely not. There's a lot of misinformation out there.
It's like a minefield.
Yeah, it is.
So how do we help people navigate all that?
I think education is key.
Okay.
We need to teach people how to evaluate health information.
Get it critically.
Exactly. How to spot those red flags.
Yeah, like how do you know if a source is credible?
Right. And how do you understand, like, research findings
It's like we need a whole new kind of health literacy.
for the digital age?
Digital health literacy. I like that.
And it's not just about consuming information.
Yeah.
It's also about sharing it responsibly.
Huge point.
We all know how fast misinformation can spread online.
Especially on social media.
And with health, the stakes are so much higher. They are, absolutely.
So yeah, think before you share.
But think twice.
Especially when it comes to health advice.
Exactly.
Okay, so we've got empowered patients,
Mm-hmm.
but they need to be informed.
Informed and responsible.
What about the doctors?
Yeah, how are they adapting to all this?
I imagine it's a big adjustment for some,
It is, yeah.
especially those who are used to being like the ultimate authority.
Right. The ones who might feel threatened by a more informed patient.
But couldn't this also be an opportunity
Oh,
or a
absolutely.
more collaborative approach
I think that's the ideal.
where doctor and patient work together as partners?
Like a team.
The doctor brings their medical expertise,
Mm-hmm.
the patient brings their own lived experience.
And their understanding of their own body.
Exactly.
Their goals.
And tech can help with that, right?
It can, yeah, those e-health apps.
Can be a bridge between doctor and patient.
I like that. A bridge.
And that leads to more open communication.
Yeah, more transparency.
So it's not just about the tech itself.
Yeah.
It's about a shift in how we think about healthcare.
Yeah, a shift in mindset.
Moving away from that old paternalistic model.
Where the doctor always knows best.
Right, and towards a more patient-centered approach.
It's about respect.
Recognizing that patients have valuable insights to share.
Absolutely.
It's a conversation.
Not a dictation.
Okay, but we have to talk about something else too.
What's that?
Health equity.
Ah, yes, a crucial topic.
Because all this amazing tech,
Yeah,
it could actually worsen existing disparities
that's a real risk.
if we're not careful.
We have to be very mindful of that.
Because not everyone has access to the same resources
Right, not everyone has a smartphone.
or reliable internet.
Or the digital literacy skills to use these apps.
And those who are already marginalized.
Yeah, lower income, rural communities, older adults.
They're the ones who are most likely to be left behind.
And sadly, yes.
So it's not enough to just develop this tech.
Right.
We have to make sure it's reaching everyone who needs it.
Equity has to be at the forefront.
And that's a whole other conversation
It is a complex one.
about infrastructure, digital literacy, accessible design
Yeah, and addressing the social and economic factors.
that contribute to health disparities in the first place.
It's about more than just technology.
It is.
It's about creating a more just and equitable world.
Okay, so we've covered a lot in this deep dive. From the nitty-gritty of e-health apps
Mm-hmm.
to the bigger picture of mobile health care
Yeah.
and the changing roles of patients and doctors.
It's a lot to think about.
It is, but I want to end on a hopeful note.
Okay.
What are you most excited about?
What am I most excited about?
Like, what's on the horizon?
What's coming next?
What could really change healthcare in the years to come?
Well, AI is already having a huge impact.
Yeah, I've been reading about that.
And I think that's just going to keep growing.
So AI-powered diagnostic tools,
Yeah.
they can catch diseases earlier.
Earlier and more accurately.
Wow.
And personalized treatment plans.
Based on your genes.
Exactly, tailored to your individual needs.
That's incredible.
It's like science fiction becoming reality.
And what about VR and AR?
Ah, yes, virtual and augmented reality.
Those are starting to be used in healthcare too, right?
They are, yeah, for pain management,
Okay.
surgical training, all sorts of things.
And blockchain.
Oh, yeah, blockchain has huge potential.
I keep hearing about it, but I'm not sure I fully understand it.
It's basically a way to store and share information securely.
Okay.
So in healthcare, it could revolutionize how we manage health data.
So, like, imagine having all your medical records
Yeah.
in one place, and you control them.
You control them
And you can share them with any doctor you want.
securely and easily.
That would be amazing.
It would.
So the future of healthcare.
Yeah.
It's exciting,
It is.
but also a little bit unknown.
A little bit unpredictable.
But ultimately,
Yeah.
we're the ones shaping it
We are, all of us.
through the choices we make.
The choices we make today will affect healthcare for generations to come.
So we have a responsibility
We do.
to use this tech ethically,
Ethically.
responsibly,
Responsibly.
and
Yeah.
in a way that benefits everyone.
That's the goal.
Well said.
Thank you.
It's been a fascinating conversation.
It has.
Thanks for joining us for this deep dive into the world of e-health.
My pleasure.
And to everyone listening out there,
Yeah.
we hope you learned something new today.
And that you'll keep asking questions.
Keep learning,
Keep the conversation going.
because the future of healthcare is in our hands.
It is.
And together, we can create a healthier, more equitable world for all.
Hey, I believe that.